Good morning, everyone. This is quite the rapid fire here, so hope everyone's still awake. My name is Corey Kidd. I'm the founder and CEO of a company called Catalia Health, and we do chronic disease care management. I started this company about 5.5 years ago, the second company that's been based on the work that I was doing here at the Media Lab about 15 years ago. So I've spent 20 plus years focused on how we solve some of the challenges of healthcare at scale. And at Catalia Health, we create care management programs for patients with a variety of different diseases. We have products on the market right now in cardiology, oncology, and immunology. So we're working with a lot of different patients. And in the market that we are focused on right now, the typical solution is a call center full of nurses where you might make 1 or 2 calls to a patient each month. We have a slightly different approach to that. So we use AI and robotics to interact with our patients much more frequently. So we've rolled this out with customers like Pfizer and Kaiser Permanente. A lot of our work is in the pharmaceutical industry where, again, you've got call centers right now interacting with patients. Now, as I said, we have a slightly different approach to this. So instead of a call center full of nurses, we have a very small call center full of nurses, and each of our patients get a cute little robot in their home. And so the reason for this is really based not on technology, but on psychology. So when I first got here to the Media Lab almost 20 years ago, I spent a couple of years running a whole series of studies looking at what technology can more successfully engage people over time. Prior to that, I'd run a research lab at Georgia Tech where we used a lot of speech-based interfaces, screen-based interfaces. And one of our challenges in healthcare has always been how we successfully engage patients over a significant period of time. And quick way to explain what we found with using interactive robots is why we're all here in this room. I know there are a number of Cambridge and Boston area people here, but also a lot of us who've flown in for this, and we get that face-to-face makes a difference. That's why we do events like this. That's why we spend so much time in meetings. And it turns out from a psychological perspective, a robot is pretty much the same as a human in terms of creating engagement. So that's our interface. We work with IDEO, the big design firm, to design this particular robot to meet those needs. And then we build these complex care management programs where this device is, again, sitting in our patients' homes, actually having a day-to-day conversation with them. So our reason for being here is we're starting to scale this up with a number of the large pharma manufacturers and healthcare systems. If you are working with a patient population and you need better programs, I would love to talk to you during the break after this or this afternoon. We also get a lot more data about what's going on with patients because of our everyday conversations. And for the investors in the room, we're also raising a Series A right now. Thank you.